everyone. I want to welcome you to the Unit Safe Return webinar. I know that there's a lot of you out there and you have a lot of questions, and hopefully we'll be able to get through a lot of those tonight. My name is Kelly Hupfeld. I am the Associate Dean of the School of Public Affairs, and I'm also one of the co-leads of the Campus Safe Return team, planning for how do we return to campus this fall in a safe way. Let me tell you who else is on this webinar. We have David Tracer, who is an Associate Dean at CLAS and is heading up the Campus Safety Committee. So he is the guru of safety questions, along with Carrie Weatherford, the Director of the Office of Institutional Planning. Carrie is the telephone symbol on your screen because he is very graciously joining us from his vacation. Of all things. We also have Paul Teske, the Dean of the School of Public Affairs and a co-lead for the Safe Return team. Elena Jones, another co-lead for the Safe Return team, who has a very long title now, Interim Vice Provost and something for student success. And then we have Doug Cassian, who is the Director of Employee Evaluation and Performance, who will give us the HR perspective. And I'm going to turn it over right now to Emma Martz, who is the Events Coordinator at the School of Public Affairs, who's going to walk us through sort of how you ask questions during this. So take it away, Emma.
Sure. Thanks, Kelly. Welcome, everyone. So I just want to go over the different options for a webinar feature. All of you attendees are muted and are not on video right now. So if during this portion, there's a big question and answer portion of this. So we ask you to submit your questions to the Q&A box at the bottom, not the chat. Please use the chat if you'd like to chat a panelist specifically, or if you are having any technical difficulties, please reach out to Spot Events, which is me. But for Q&A, I just want to kind of go over how to do a question. So right now, and actually since I'm the host, one of the hosts of this, I can't submit a question, but basically what you would do is just type your question in, and we will see that. If someone agrees with the question, or there we go, thanks Elizabeth. So one of the panelists will get your question, answer it live, so they'll tell you what the answer is, or they will type an answer based off of who gets your question, and then you can upvote the question. So if you like that question that someone asks, please type the thumbs up. That way we know that that question needs to be answered sooner rather than later. If you have any questions at all, please feel free to chat me throughout the discussion. Thanks, guys.
All right, thanks, Emma. So we're going to start off, like I said, we want to have most of the time dedicated to your questions, but we're going to start off with a quick overview. Paul's going to give an overview of just kind of this process and where we're at. I'm going to talk a little bit about the planning process and submitting your plan, and then David and Carrie are going to talk about some overall safety issues, and then Doug is going to talk about some HR issues. And then we will go into the question phase. And I think we're going to try to chunk up the questions in terms of big categories. So first we'll talk about safety questions, then we'll look at HR questions, and then we'll kind of save whatever's left for the last batch of questions. So Paul.
Thanks, Kelly. Thanks all for being here. I see about 130 people, which is great. We're popular. We're glad. We've been working on the Safe Return plan and implementation since late April. And, you know, there's lots of metaphors. It's like nailing Jello to the wall or driving in thick fog. There's tons of uncertainties out there. You know, we're trying to make what we can as certain as possible. And for our main, you know, purpose as a university for teaching students, you know, we have needed to have a process to figure out what courses we can deliver on campus, in what form, and what classes we're delivering remotely and online. And so we are pretty far along in that process now, and we're delivering about a quarter of our classes with a hybrid or on-campus element. So that means there will be students on campus. The other 3/4 are being delivered remotely or online. And so in terms of, that's what faculty and students will be doing. In terms of staff return, you know, we don't want a ton of people on campus, but we want the right people on campus who need to be there for the most important tasks in working with students and with faculty. So again, we're trying to keep the capacity down, the physical distancing, all the safe public health aspects on campus as much as possible, but still deliver a quality educational experience to our students and support to our faculty and researchers. So that's where you guys come in. We're trying to plan for your partial return for the fall while we're balancing all these things. So we want to get to your questions, so I won't say anything more, but again, thanks for being here. And I guess, Kelly, back to you.
So the planning process, so you all received a link to the FormStack unit safe return plan, and we're asking you all to fill that out for your units. And how you're defining your units is kind of up to you. It's sort of a functional thing. So if you've got, for example, an office that's split into 2 different spaces, you might want to file 2 different unit return plans. The unit return guide that was also sent to you can walk you through that process. When you go through the unit return plan, we are not looking for like the greatest possible amounts of details. You will go into that when you go through your space plan at the end, and people will help you. People from the safety committee and the Office of Institutional Planning will help walk you through that. So don't feel like you need every last little detail about, you know, this plexiglass needs to be this big kind of thing during the unit return plan process. Just do the best you can. You're trying to figure out, you know, what is your return going to look like? What is your presence on campus going to look like? How are you thinking about the work of your unit that needs to be on campus and how you're going to staff that? So that's basically that process. We're going to get a lot of unit plans, and we're trying to process them in a really quick way. Obviously, the quicker you can get yours in, the more quickly we can process it. We'll try to prioritize the people who are looking to be back soonest, and we'll go from there. So that is pretty much all I had to say about this process. So I'll turn it over to David and Carrie.
Great, thank you, Kelly, and welcome everybody. And as Paul said, this process has been going on for a number of months right now. And I just wanted to give you a very brief overview of some of the safety protocols that we've put into place over the last few months on campus, which will inform your unit return plans. But I wanted to start off with telling you a little bit about our philosophy. And our philosophy is that, as you'll read in the unit return guide, there are 3 C's that have been implicated in the spread of COVID-19 and that we are trying to avoid. And were sort of the basis for putting into place the protocols that we did. And those 3 C's are closed spaces. So just to give you a concrete example, an elevator is a very closed space. And for that reason, one of our recommendations is that people always take the stairs when possible. We recognize that people are not always able to take stairs, but therefore we've limited occupancy pretty severely in elevators. But to avoid closed spaces, we have recommended that people take stairs. A second C that we're trying to avoid are crowded spaces. And so, for example, we do recommend in the unit return guide that even as your units do return, you continue to conduct meetings via Zoom. So if you have a faculty meeting, we don't want to pile everyone into a single conference room. We want to social distance. We want to avoid crowded spaces. And Carrie will have more to say about that. We've severely cut down on the occupancy in classrooms, for example, to cut down on crowded places and spaces. And finally, the third C is close contact settings. This would be sort of clinical settings if we're talking about a clinical setting. But for example, many faculty have a 120 square foot office, and we have recommended 120 square feet per person as the recommended occupancy space. And for that reason, faculty should probably not be meeting with students during office hours in person in their offices. That would mean 2 people in a 120 square foot space. and would kind of violate the third C, the close contact. So we're recommending that office hours too be conducted via Zoom. So that's the philosophy underlying our protocols that we have in place. I can't possibly go through all of our protocols right now, but I wanted to let you know some of the most salient that we've put in place. Everyone returning to campus will have to take an online training. That online training is available right now through your UCD Access portals. I've taken it, takes about 30 minutes, and it's pretty informative. And everyone is required to take that and save your certification after taking that to come back to campus if you're going to be on campus in person. We've instituted badging to be able to be sure that people circulating on campus are entirely, or at least predominantly, members of our campus community. So everyone is required to wear ID now when they circulate around campus. And in addition, our buildings will be on holiday access, which means that you will need your badge to enter the buildings that you need to enter. We are currently having a health screening in order to come to campus. That's a daily health screening that involves answering 3 questions about possible COVID symptoms or contact with individuals who might have COVID in the recent past. And it also involves a temperature check. Right now, it involves a temperature check on campus. Going forward, it might involve a temperature check at home in lieu of that. That's still being developed. And right now, we are at a on-campus temperature screening protocol. Face coverings are required everywhere on campus, inside buildings and outside. Those are typically going to be masks for individuals who cannot wear masks or it's not feasible to engage in their activities while wearing masks. We are recommending face shields, which are not affixed to the face, but have a headband type structure with a plastic shield coming down. Social distancing is a really important protocol that the Colorado Department of Public Health and Environment and the CDC have put into place. And this means maintaining a 6-foot distance from others at all times. And the last protocol that I will quickly mention has to do with circulation patterns within buildings. And what we have instituted and AHEC has instituted for all the institutions on campus as well is a stay to the right policy. So when you're going down a stairwell, when you are traveling through a hallway, you will always stay to your right in the direction that you're traveling. And of course, always maintain a 6-foot distance to any people who are either in front or behind you. If you're inside of a unit suite, you will still stay to the right when traveling within that suite. You will maintain a 6-foot distance. And as I mentioned, we are recommending 120 square feet per person. So that is going to severely cut down on the occupancy of your units if you're located within suites particularly. And with that, I think I'll hand it over to Carrie to talk a little more about the space dimensions of our protocol.
Thanks, David. Hello, everyone. Sorry that you can't see my face, but excited to join you via phone. So what we've been working on in the social distancing realm was really starting with instructional spaces. So classrooms and instructional labs. And what we've been doing is using essentially a 7-foot, 10-inch diameter circle to determine what the occupancies of those spaces would be. I know that 7 feet, 10 inches sounds like a random number, but essentially it allows for 6 feet of distancing between people when you account for the average size of a human torso. So we began by using that 7-foot 10-inch diameter circle, putting that into classrooms and instructional labs to arrive at a modified capacity for those rooms. We then transitioned into research labs and went through the same exercise. And now that we've arrived at the unit return plan process, the idea is to continue using that 7-foot 10-inch diameter circle to work with all of you and your units to make sure that we're adequately spacing people out in the office environment. So I want to clarify, David and Kelly both mentioned 120 square feet. So we'd like for you to use that as a basic metric when you begin your unit planning in the early stages. But once you reach the point where you're going to be working with the Office of Institutional Planning on your specific space plan, we're going to get in to a little bit more fine detail, and that's when we're again going to use that 7-foot 10-inch diameter circle to apply to your office environment to figure out what the safe occupancy of the office environment is going to be. Typically, you know, for offices that are predominantly traditional four-walled offices, you're going to be looking at single occupancy for those offices. Where the distancing circle is going to come into play is going to be in open office environments, in areas like conference rooms that might be proprietary conference rooms for your particular department or unit. When you get to the point in the safe return planning that you are ready for the space plan process, what I've had a few actually people do already, some units, is to reach out to David and I and share with us who their unit return coordinator is going to be. And I think that's great. We're starting to track who those people are so that we know and we have a running list of them. Megan Cranston in the Office of Institutional Planning is going to be our lead rep interacting with those unit return coordinators as we begin to work on your space plans. But it would be great if once for each of the units that are submitting a safe return plan, if you want to go ahead and identify, once you identify who your coordinator is going to be, feel free to reach out to David and or myself, and we'll keep tracking those. And once you're ready for the safe plan, we'll get you connected with Megan and get you in the pipeline and start working. So we're looking forward to digging in with all of you and getting into the details of your space. And I know you'll probably have a lot of questions related to that, and certainly happy to answer those. So thank you.
All right, thanks guys. We'll turn it over to Doug for a quick overview of HR issues.
Thank you. I appreciate the opportunity to participate in this forum, and thanks for everybody's interest in being here today. From an HR perspective, I'm going to cover a couple of topics having to do with concerns about returning to campus. We certainly understand that there may be individuals that have concern about that and have underlying health conditions and or individuals in their residences with underlying health conditions that they are concerned about exposing to potentially the COVID-19 virus. To that end, what we are doing is putting together a kind of a streamlined process that's a combination of, we recognize since some of these things have medical conditions underlying them, that this could be an ADA issue. If it's somebody in one's residence, that's not necessarily going to be an ADA issue. So it's really kind of a combination of an ADA issue and a health condition. I'm not going to use the word accommodation for that, but arrangement. So how that would work is we will have a form stack process where an individual can provide information online to us, identifying their concern about returning, either due to a disability or an underlying medical condition. and which would also then ask the employee to identify if they're comfortable working with their supervisor on possible arrangements, or if they would like HR to be involved in kind of brokering that discussion. The idea here is we would ask for minimal medical documentation. If anybody's familiar with our typical process, it's usually a couple of pages of information that we ask an employee to have a medical provider complete and return to us. This would be as simple as a note from a medical provider identifying that an individual has an underlying medical condition or resides, or the person that resides with the employee would have to provide a note identifying that they have a underlying medical condition without necessarily identifying the medical condition, but it would have to be a qualified medical provider that would provide that. We don't want to dig too deep into medical privacy issues. And then we would collaborate on and document that arrangement. So, hopefully we can get some pretty swift turnaround and arrangements in place with regard to those concerns. And then second issue I'd like to address is, staff preferences and making decisions about staffing. Obviously we've got business needs to meet, but I'm a firm advocate for bringing employees into that discussion and getting input on how to meet those business needs and engaging staff in that process. So that could result in staggered hours during a day or staggered days during a week. I think there are options to explore and make sure that everybody being served by the campus is getting what they need. So those are the couple of things that I had to bring up, and I think now we're going to open it up for questions.
Yes, and we've got a lot of questions. One thing that I've seen a couple people raise is the question of enforcement. So if we see people around campus, whether students, other colleagues, not complying, what are people supposed to do? And how do you suggest units think about that in terms of their return plan? Should they have a plan for that? And I'm asking David and Carrie specifically.
So enforcement is a tough issue, I will say. If you look at the unit return plan, it does say at the top that by completing the plan, all the people coming to campus are agreeing to abide by all the COVID-19 protocols in place. You agree to that as well when you take the COVID-19 training through UCD Access. I think that we are going to have ambassadors around campus as well. And as a matter of fact, MSU had a small campus return this week, and they do have about 10 tents around campus with ambassadors. The ambassadors are reminding people of the protocols. If someone is in flagrant violation, then we may have to contact Auraria Police. We're not certain if Auraria Police is going to get involved in enforcement of COVID-19 regulations yet, but I think what we need to do is just broadcast to our community that we're all in this together, that when people have not observed social distancing and wearing a PPE, that's when COVID has spiked. And we have people on campus who are vulnerable, either by virtue of their immune systems, by virtue of age, or a number of other factors. So, you know, we're working on compliance issues right now. I know that the Student Code of Conduct is also going to be another point by which we enforce our COVID-19 protocols. But I think what we really need to do is let people know that we're all in this together. And we do have signs that say, my mask protects you, your mask protects me. And we just have to really hammer home the message that we're protecting one another.
Yeah, this is a tricky issue, and I think we all need to take responsibility for making sure that we communicate that message. I think we don't want to be a campus of people going around telling on each other, but we do want to be a campus of people who are supporting each other in adhering to the safety protocols. You know, in the current environment, calling police on somebody for that is probably not our first thing that we would want to do. But just think about it in terms of, you know, how can you help others, help remind others that this is really important for all of us. And, you know, it'll be tricky. It's not easy to, you know, to talk to people about that, but I think we all have to make an effort to do that. So David had mentioned that students, it will be a violation of the Code of Conduct. So if we do have a particularly flagrant instance of a student refusing to follow the protocols, that can be handled through our conduct code violation process. Let's see. A question that looks like a lot of people would like answered is the question of safety or screening stations and where they're going to be and how exactly that's going to work. So David and Carrie, do you want to walk us through that?
So that's evolving and will evolve between now and August. We started with one screening station, which was located at the end of the 1600 corridor of North Classroom. Again, people need to take the COVID training before coming to campus. Then there's an attestation form where you're attesting to the fact that you haven't had symptoms and you haven't been in contact with anyone with COVID, and you also agree to abide by our protocols. The attestation form can be filled out at a screening station, but we strongly encourage people to fill those out before coming to campus. So that link has been circulated, and we'll circulate it again prior to the start of the fall semester. Once you fill out your attestation form, you get an email that clears you for coming to campus if you've answered no to all the questions and agreed to the protocols. That email is green if you're cleared, so you can just show that, and they look at the color at the screening station. They take your temperature, they give you a daily wristband. Now again, we started with one station. We were only having about 30, 35 people per day going through it when we started. That doubled a couple of weeks later. We opened the second screening station. So we have a second one at Links Crossing right now. And if we stick with the on-campus temperature checking, we will open quite a few more. I can't say exactly how many, quite a few more is right now. We need to see when we get the unit return plans how many people approximately will be coming to campus. Are those people coming daily? Are they coming just several times a week? If we do open up and we have a fair number, we will open up and we have a fair number of people coming, we're imagining at least 4 checkpoints on the Auraria campus, as well as at least 1 checkpoint across Spear Boulevard servicing the Lawrence Street Center, the CU building, and the business school. And that's a really conservative estimate of what we would need. We might have many more. but we'll see once we get those unit plans in.
All right, Carrie, anything to add to that?
No, I think David, that was a good description of our intentions and where we are at this point in time.
Okay. So there's a question about since we're a shared campus, you know, we have our own plans. How does that work in terms of how we work with AHEC?
That's a great question. So when CU Denver was going through its planning process, AHEC had what they called a quad institutional planning team as well. And the quad, the 4 institutions are the Auraria Higher Education Center itself, CCD, Metro, and CU Denver. And there were representatives from all of those institutions on that planning committee. And I was actually on that planning committee in addition to the CU Denver planning committee. There is now an AHEC implementation team, just as there's a CU Denver implementation team. And again, there are representatives from all of the institutions on that implementation team. And once again, I'm on that team and Carrie is on it as well. And there are other individuals like Chris Puckett is also on one of those implementation teams. And what we've just reached in the last 2 weeks are consensus statements on where the institutions agree. And pretty much all of our protocols we've reached consensus on. So wearing a facial covering anywhere on campus, inside or out, we have reached consensus on that. Initially, some institutions were going to have one-way corridors and stairwells. Other institutions were going to adopt the keep to the right policy. We reached consensus and decided, since it's not feasible to have one-way stairwells and circulation patterns in all buildings, but it is feasible to have the keep to the right policy everywhere on campus, all of the institutions, Auraria, CCD, Metro, and UCD have reached consensus on that. There's one area in which right now we're still at a point of divergence, and it's not major divergence, but it's simply that CCD and Metro will be allowing individuals to take their own temperature at home and fill out their attestation form and fill in their temperature at home before coming to campus. And we are still requiring, as is the protocol at Anschutz, for individuals to have their temperature taken on campus. That will it might either change for them or us before fall. We're uncertain. That's really the only protocol that's different between the institutions. Virtually every other protocol we've reached consensus on.
Yeah, I would just add real quickly that the distancing protocol is consistent as well. So when I spoke earlier of the circle, the 7-foot 10-inch diameter circle, that was actually a metric that was that one of the things that came out of the planning process that David referenced, the tri-institutional, quad-institutional process, was that spacing metric.
We've also had a couple questions about what contact tracing will look like.
So we're in the process of putting together a contact tracing team. It will likely initially be a student team of contact tracers. The Rocky Mountain Prevention Training Center has put an online contact training on contact tracing training, say that 10 times fast, online. It's a 4-hour self-paced training. We're gonna start off with a team of about 6 to 8 contact tracers. And they are going to interface with, and we are going to ultimately sign an MOU with, although that's still being drawn up, DPH, which is Denver Public Health. They are still implementing a text solution in which the contact tracing information will be entered. That is supposed to go live at the end of this month. I have a meeting on Thursday about that, but we're well on our way to getting a contact tracing team trained and implementing that certainly by the start of fall semester and perhaps one or 2 weeks before the start of fall semester. It's a good question.
All right, a couple questions about access to buildings and figuring out, so obviously if I work in a particular building, I know to get access, badge access for that, but what if I want to go into a different building that I don't typically work in? Or what if a student wants to go into a building that they don't, maybe that they don't have a class in? How will that work?
David, you want me to take this one?
Sure, Carrie.
So right now, the campus is in what we call holiday mode, which is all the buildings on campus are only accessible, not only with an ID, but an ID that's activated to go into that particular building. As we transition into fall, I can't say as I sit here right now that we've worked out all the details, but obviously we'll have to plan for the very scenario that Kelly described, which is that we're going to have people coming out of one building and going to another building. And there's a couple ways to look at that. One is to provide access to individuals that need to access multiple buildings, not just the building that they work in. The other is to look at a different layer of access on the campus where the buildings might not be still functioning in holiday mode. Part of what David described earlier, which is the ambassador program, where we would have people greeting individuals at every building when the campus opens in the fall. It's implied in that scenario that there's a single point of entry for each building on the campus once we reopen in the fall, and that everyone is passing through that single point of entry into the building. I don't know that we've talked about this specifically, but I think logically, if you take that scenario and that protocol and you imagine how that looks in practice, what seems like the likeliest scenario is that that single point of entry into each building where we're going to have the greeters, the ambassadors there at the door would be open to people to enter the building. And as people enter the building, we'll be looking for those persons to be displaying their ID badge, just so we know that they are in fact affiliated with one of the institutions or the Auraria Higher Education Center. I think that latter scenario that I described is probably the most likely, where we would have ambassadors at the single point of entry in each building, and therefore you would not need to necessarily badge into the building, although you still would need to display your badge to get into the building.
And if I could just jump in for 1 second, Carrie is on vacation, and that's why he's joining us by phone. And I was in a meeting, an AHEC meeting, and AHEC has decided to leave the single points of entry open during regular business hours. So that decision has not been made for CU Denver owned buildings, but for AHEC, that latter scenario that Carrie just described, his crystal ball was accurate.
Couple questions about visitors and how visitors are handled.
So that's still being worked out right now. And in our safety team, we do have a sub team that's working on visitors, but it's likely that visitors will have to be logged somewhere. And the main thing to say about visitors is that they need to follow all of the protocols that everyone else on the campus will be following. But by logged, what I mean is they need to have a sponsor from some department or some unit on campus. And the unit will be responsible for apprising those people of what the protocols are, where they can go, what areas are off limits, and things of that nature.
So I would like
I will say in the sorry, Kelly. I was just going to say in the planning discussions with AHEC, two things were talked about in regard to visitors. One David mentioned, which is a sign-in process. The other was that we might have, if someone is sponsored, that the person would have to come get the visitor at the door. The university or AHEC or Metro or CCD person would have to greet the visitor at the door. We could end up with both, where there's you have to come greet the visitor and there's a sign-in. I don't think that's out of the realm of possibility, but as David mentioned, it's still a work in progress.
I want to make sure that we're able to get to some of the HR questions. So I want to close up at least this part of the safety discussion with a question that I've seen a couple people ask, and that is, you know, the COVID-19 situation is changing all the time. So, you know, Colorado was doing really great and now we're creeping up a little bit. How do we know when it's time to phase back down? And this is something that the team is actively looking at right now. So having conversations about what are the variables that we need to be monitoring. We'll be talking to the School of Public Health. We'll be talking to Denver Public Health. Do know that leadership would like to develop a plan where we don't necessarily go from black to white in the same way that we did in the spring, where all of a sudden, okay, now we're completely closed. They would like to be able to look at it in terms of what are the variables that would cause us to close down a classroom? What are the variables that would cause us to close down a particular building? When do we think about going from, say, 30% occupancy on campus to maybe 10% occupancy on campus? And so these are things that we're going to be looking at and bringing a proposal to leadership. Probably take us a couple weeks to be able to get that together, I'm guessing, but do know that that is being put in place. And the goal is to not have, again, that unless something dramatic happens, obviously if something, you know, if all of a sudden just rates go through the roof, you know, we'll obviously do what we need to do to make sure people are safe. But the idea is to try to be a little bit more nuanced about this and be able to go up and down with the variation in COVID-19. So I want to turn this over to some of these HR questions. And Doug, here's an interesting one. Is the overarching message here that if you can work from home, you should work from home?
I don't know that, I mean, I think that's got to be part of the strategy to address this, and certainly the approval of a plan like that. And I see there are a couple of questions along those lines. The approval of that kind of approach is going to reside with, you know, the authority in charge of that area. I encourage the dialogue on that, but ultimately, you know, I don't think you know, it's a decision that HR has purview over.
All right.
And I encourage the discussion in that way.
Okay. There's another question, Doug, for you on, do all individuals need to submit the FormStack form for medical conditions regardless of whether they can work with their supervisor?
Right, yes, and I hit the wrong button there, so I would have answered that online, but yes, the answer is yes, because, you know, we want to be sure that we have a record of these issues, and, you know, if it is an ADA issue, our office really needs to have documentation of that. So we would like to see all of those. Yes.
Okay, great. Let's see, I'm not sure I see any other HR issues. We did have a question beforehand that you may have answered, and forgive me if you already did. Employees who live with others at home who have conditions that put them at risk. So let's say that I live with my grandmother who is 80 years old, or I live with someone who has a chronic lung condition or something like that. What is my status on that?
Right, same process. You would identify that through the FormStack process, and and the individual residing with you would provide a note from their medical provider identifying the underlying medical condition.
Okay. Let's see. Someone is asking about if someone tests positive for COVID in our unit after we return to campus, what is the process for handling that situation? And David and Carrie, you might be able to have input into this as well, because this is part of the contact tracing situation.
I'm terribly sorry. I was typing answers to questions. And
So the question is, what do we do? So we've got our plan, we're working, someone in our unit tests positive for COVID. What do we do?
Yeah, so if someone tests positive for COVID, they're going to go into self-quarantine. Obviously, if they need to be attended to by a healthcare facility, they need to go to a hospital and have the appropriate treatment. And that is where contact tracing kicks in. Contact tracer will contact the individual and find out the locations that they were at and the individuals with whom they have had contact. Now, let me say that individuals, if everybody is maintaining their 6-foot distance, mostly, and if people are wearing PPE, then having a positive person in your midst is only a problem if there was relatively close contact, so much less than the 6 feet, for a period of approximately 1 hour. So if you have an individual who was in your unit, who was walking by others, and everyone was observing the keep to the right protocol, and that individual was wearing PPE and everyone else in the unit was wearing a facial covering, the risk is minimal. That said, the contact tracers will determine who had what's determined to be close contact for enough of a period of time to be at risk. Those individuals will be told they are at risk, and they will likely be recommended to a self-quarantine for 10 to 14 days. But again, just having someone incidentally in an office suite who tests positive but was observing the protocols, other individuals are not going to be at a substantial risk.
Kind of another group of questions that I'm seeing is, what if our unit decides we can do all of our work remotely? You know, is that okay? Is that a decision that it's okay for us to make? And I think, and you know, Elena, if you want to jump in here, the way that we're sort of thinking of that is your unit needs to think about who are you serving that you would need to have an on-campus presence for. And we're not talking about that in terms of, you know, you absolutely are 100% required to be on campus. It's more of, does your, like if you're serving students and they're going to be students on campus, what is the best way for your unit to serve those students? And it might be that an on-campus presence is requested or is required. If you are a, you know, a sort of a back office unit, you may be able to serve your constituents really well remotely, and you've been doing that, and it's okay to continue doing that. Again, you know, as long as the leadership in your area agrees that your work can best be done this way. I can tell you that at the School of Public Affairs, what we're doing with advising is we've determined that remote advising is working really well, both for us and for our students. And so we would like to make an opportunity available for students who want to have in-person advising. So we will have a small presence in the office. We'll have advisors rotating 1 day a week. And if somebody wants to make an in-person appointment, we'll honor that, but otherwise our default is to do remote advising. And so I just offer that as an example of something where we looked at who are we serving, what do we need to serve them well, and this is the combination of things that we ended up with. So anybody else who wants to jump in on that one? I know it's a tricky issue.
It is, and I think a lot of people have wanted to have a hard and fast answer one way or the other, and the reality is it depends. And just as Kelly articulated a great example and the considerations and guiding principles behind that, I really do encourage all of you to be speaking with your leadership. It's really important that the leadership and the units are in alignment in terms of what is expected relative to the services you provide to students and faculty. And that can guide a lot of your thinking.
How about if someone is technically in a high-risk population, but they are having a hard time working from home? You know, maybe it's just not a great environment to work at home productively. Are they allowed to make the decision that they can bring themselves back into the office environment, even being at high risk for a more serious infection? I say the answer is yes, but I'm looking to Doug.
I'm sorry, say the question again. I lose type.
We're trying to multitask here and it's hard. So the question is, if someone is themselves in a high-risk population and they're allowed to work from home, but the home environment is actually not where they prefer to work, are they allowed to bring themselves back into the office with that high-risk status?
That would be that employee's choice to do that, if indeed that individual wants to do that. We're not going to force people to be out of the workplace because of that high risk condition.
Mm-hmm.
So.
Okay. All right. We are we've got a lot of questions yet, but we've still got, we have about 8 minutes or so left. I want you to know that the panelists are willing to stay on later to answer questions if people would like to stay. But let me see if I can get to some of those questions that were not sort of in any particular bucket. Let's see. And if anybody else wants to jump in on questions that they can answer, feel free to do that. Okay, I think I'm just gonna start reading the questions. I think we already answered that one. What is the process if we need to return to campus to retrieve work items? So this would be the process for somebody coming in this summer. So what do they need to do?
I just typed an answer to that. Okay. The short answer is you should clear it with your supervisor and get permission from your supervisor. Your supervisor should then contact Jim Nelson, who is in facilities. That's jim.nelson@ucdenver.edu, and Jim will get you on the access list.
Okay. What do we do when we've got visitors who are outside of screening station hours?
So the attestation form is currently being modified. It's not there yet, but currently in order to do the attestation form, you need to log in with CU credentials. But it's being modified both for vendors and other visitors who do not have CU credentials. And outside of hours, we would simply need somebody to fill out the attestation form. So if they're asked for it, they can show that they got the green email, the green light as it were, to enter campus. And then they just have to comply with all of our protocols. That's for nights and weekends as well.
A couple questions on parking. So as we are transitioning to something where we're definitely going to have less than 100% of our people on campus, how are we going to be handling parking?
Well, there's, I don't know if we can get more specificity on that question, but there are two parking environments, if you will, for CU Denver employees. So there are those that are parking on the Auraria campus in the lots that are in garages that are managed by the Auraria Higher Education Center. And then there are the three below level garages in the CU Denver building, the business school, and the Lawrence Street Center that are managed by the CU Denver parking staff. In terms of the garages that are managed by CU Denver, there are discussions about how we might potentially modify the way those garages are managed to account for the fact that we may see a rise in parking demand for the fall semester. Being that many people who typically would have taken public transportation to get to the campus may not elect to do that, or most likely would not elect to do that in the fall. And I know that Jay Campbell and his team are working on some different options to provide additional parking, whether it's modifying the way the garages function or looking for other opportunities in the central business district for CU Denver employees to park. On the Auraria side, we talked about that concern about parking demand and felt like the additional demand for parking based on people not taking public transportation and the fact that we expect to have quite a bit fewer people on the campus than typical, that those would in effect balance themselves out. But as far as I know, and David, correct me if I'm wrong, the surface lots and parking garages at Auraria are expected to function more or less as they have functioned in the past once we come back for the fall semester.
Okay. I'm seeing a couple questions about overall capacity in terms of the building, in terms of overall return to campus. We are currently managing this sort of from the ground up. And once we get more of the unit return plans in, I think we'll take a look at some density analysis of who's going to be in the building at what time. We did just get, I don't know if everybody saw this, but there was just guidance put out from CDHE on returning in the fall, and they suggested, or CDPHE guidance related specifically to higher ed institutions, and they suggested that we be looking at somewhere around 30 to 35% capacity on campus, and that we be looking at reducing in-person interactions by 65% from normal. So if that gives people kind of a general sense of what we're aiming for as a campus, again, we're trying to build these from the ground up in terms of what does your unit need to provide on campus, and then we'll be looking at it from the top down of, okay, are we managing capacity overall appropriately? So I hope that helps.
And Kelly, just related to that too, I think, and Carrie can jump in, but yeah, we will be doing that bottom up. I mean, some buildings like Lawrence Street Center with 14 floors, you know, each floor might be kind of coming up with their own plan, but when you add it all together, it looks like too many people at one time in the elevators or the stairwell. You know, we'll adjust for that, but we want to look at that first. And, you know, in terms of classroom, we just did the re-rooming, and about half the classrooms on campus are going to be used, and for classes, and about half are not. And those may be opportunities. There were some questions about landing spaces for students, but we're looking at that in terms of computer labs and other available spaces when a student, say, has an on-campus hybrid class, but then they're on a Zoom class, you know, an hour later, and they can't get home, so they need to have a place to do that.
Yep, okay. A couple questions about student employees. When can they come back? Is there going to be any guidance about student employees? Doug, do you have any input on that?
No, I don't.
Okay.
No,
I thought that I heard that the Career Center was putting together some guidance on that. We can check into that for people. I don't know the answer to that.
Kelly,
yeah.
would that be part of the unit plan? I mean, if they're preparing for the fall, I don't know if the question was specifically related to summer, but if it's the fall, I would assume they would put it. It would be part of the staffing plan that they would submit
Right.
with their unit plan.
Yeah, that's a good point. I mean, nothing about this prevents people from having student employees. So work them into your regular staffing plan if you're planning to have them.
So if the question is currently, then they would follow the protocol that David walked through to gain access as a critical employee, although I would expect that that there probably would be few student employees that would be deemed critical or essential, as we've applied that definition for the summer. So I think we're primarily talking about fall, and then
Right.
they can just be included as part of the staffing plan.
Right. Okay. So we are at time, and we want to be mindful of your time. We will take a look at all of the remaining questions and get those answered. In addition, if you want to email us, any of us, for answers to your questions, we're happy to do that as well. And obviously, just as you're filling out your unit return plans, we'll be right there to help you with those. If people want to stay, we can continue. Some of the panelists can stay for about 15 minutes and continue asking questions or answering questions. If people want to do that, we're happy to do that. But if you need to leave, we understand that. So thank you. All right, panelists, you ready to attack these questions? Okay, so we have, again, there is this overarching question of how do we think about our employees' safety versus our mission as a university? And I think the best way to respond to that is we are following guidance from the state and from our local public health departments. And so right now, the state of Colorado is in its safer at home phase, and it's got guidance relating to that about what we can and can't do in terms of interactions. And we are generally following that guidance. If the state gets to a point where the state is saying, you know, you need to back off, of course we will do that. But this is the best way that we know to be able to balance what we are supposed to be doing as a university under the current conditions, while making sure that everyone stays as safe as possible. So that is really the best answer that we can give to that. Again, if you run into a situation where you've got a supervisor that you think is really being unreasonable about something, take that up to HR. I'm not saying that, everybody in the university is going to have, lovely, wonderful, affirming conversations about all this. Some of these conversations might be tough, and some relationships might be tough. And if that's the case, definitely take it up to HR. Will we have an attestation for visitors to complete? Do they have to complete Skillsoft? How are we making sure that visitors will be able to comply with our protocols?
But once again, access to the attestation form and certainly Skillsoft, which is in the portal, is not currently available to individuals who are not members of the campus community. So the attestation form will be required. Going through the health screening station will be required, but the attestation form is being modified right now so that visitors can get to it.
Okay. Another question, will building hours return to normal when classes begin?
What does that, I'm not sure what that means. Building hours are normal, they're just locked and access through badge access. In the fall, again, we will likely have one point of entrance and one point of egress. We might have multiple points of egress, that's unclear, but one point of entrance certainly to buildings right now, and that will likely be open as we discussed during regular hours.
Okay. So here's a question about recent studies on aerosol transmission challenge the idea that a positive test by someone who's been taking approved protocols does not imply risk to the rest of the unit. Is that being taken into account? This
So
might.
all current studies are being taken into account.
Yeah.
And there's a lot of conflicting information right now. I mean, I think the only thing I'll say about aerosolization and particles right now is if both parties are wearing face coverings and particularly masks, there is not a lot of aerosolization that is getting out if everybody is complying. It's when we have lack of compliance that there's a problem. Face shields are less effective when we're talking about aerosolized particles, but they're not non-effective, they're just a bit less effective. So yeah, it's all being taken into account, but I would never say that there is zero risk, even if everyone is wearing face masks, but the risk is drastically reduced, even for aerosolized particles, if everybody is wearing a face mask and complying with social distancing.
We have a question about the handy van. That I think is that an AHEC service? Okay, so that will be a decision of AHEC as to whether that continues to operate. Doug, just to let you know, we have had a couple instances where employees with disabilities are asking, how are these going to be modified to make sure that, that places are still accessible. And so that's definitely something that we'll need to make sure that we take into account. I just want to flag that for future planning.
Yes, certainly if individuals are experiencing access problems, challenges, we need to know about those, and we'll work with whether it's our facilities or the AHEC folks to get those resolved.
Okay. Let's see, here's a question. How do you take into account the perimeter of the room with the 7-foot 10-inch diameter, given that people don't have to stay 6 feet away from a wall? Okay, spatially beyond me, so I'll let Carrie answer that.
Yeah, so I wish I could bring up a sample drawing to show the audience, but yes, you don't have to space from a wall. Typically what we're doing is working from the front of the room. So I'll use an instructional, like a classroom as an example. We've got a 6-foot, in most rooms, we've got a 6-foot area from the teaching wall. If there is a teaching wall, some classrooms don't have a traditional teaching wall, but if it does, there's 6 feet out from there. And then we're spacing people both horizontally, if you will, and then from the front to the back of the classroom. And we are accounting for the fact that you don't have to space out from the wall. I wish I could, I know I'm not answering this question very succinctly, but at some point we will be sharing, I hope within the next few weeks, the room drawings that we've been producing. And I think as the unit return coordinators begin to work with the planning team, you'll begin to see how we're approaching the business of spacing people out. But we're certainly accounting for the fact that you don't have to distance out from a wall. We're looking at how people are distancing from one another.
A question on how we'll be operating our See You Succeed program. And this has come up for units also who will be doing work with partner organizations. So for example, the School of Education has student teacher programs, where they go and teach at area schools. How do we think about when we interface with other organizations? How do we bring safety protocols to them, or do we bring safety protocols to them? I think my take on that is that from the discussions that I've been in, it's something that is addressed by the unit plan in terms of, have we reached out to those organizations and do we know that they are taking appropriate safety measures? If that is the case, then that should be fine. If it's not the case, then we probably wouldn't approve university employees to go out to those places. I would say that that is still a little bit in evolution, and I think as unit plans come in, we'll see sort of what issues people have with that and be able to provide a little bit clearer guidance on that. There's been progress in using UVB lights to help kill coronavirus in the air. Is that on the radar as we look at mitigating measures?
So my understanding from the facilities team is that not at this time.
I mean, we have to balance risk. UVB is also a potent carcinogen.
No. All right. Let me make sure that I cover also the questions that people sent in ahead of time. Doug, is there any possibility that classified staff would be furloughed at any point?
No, at this point, the ability to do that, or the authority to do that, is granted from the governor, and the governor has not gone in that direction for whatever reason.
Okay. Another question about, some universities are deciding that they're going to close after Thanksgiving break so that students are not coming back to campus after that. And have we considered that? And I'll answer that. So the answer is no, that's not currently part of the plan. But obviously it's going to depend on what conditions are. And we actually have a short period of time between Thanksgiving break and the end of the semester. And so looking at, what the conditions are at that point, it might be that, we encourage faculty to, for example, spend that week online or something like that. But at this point, there's no plans as an institution to close down after Thanksgiving break. Computer labs. This is something that people are asking a lot about. What is the plan for computer labs?
I can tackle that one. So we are working with OIT to look at the 3 general use computer labs that we have on the campus. There's one in North Classroom, one in Student Commons, and one in the Tivoli. So the plan is that those will be open in the fall, but we're looking at how to safely distance students or maybe modify the functionality of one or more of the labs if we need to turn it into a print-only location. So we're studying that at the moment. We've also reached out to representatives from each of the schools and colleges to begin to look at their own proprietary computer lab spaces and determine how those might function in the fall, and if we could look at using some of the stations in those proprietary computer lab rooms that might be traditionally used for courses, or they might be used for coursework that's taking place outside of a classroom. If we might be able to open up some of those stations for students who may be on campus and needing to join an online course, or they just need a place to for computer access. I would say lastly, we're also monitoring the rooming process to see which rooms, just based on our modified occupancies that are just too small to offer classrooms in. We're waiting to see which of those rooms drop out of the course rooming process to see if there's an opportunity to use some of those rooms to allow students to access computer terminals on the campus. So those are kind of the 3 approaches that are ongoing. We'll certainly update everyone as those processes move forward and we get more information about that, but it is something we're very much thinking about.
All right, we had a question also on cleaning protocols and talking about the labs, computer labs might be a good segue into cleaning protocols. How should people be thinking about that?
By and large, when we looked at cleaning protocols at the outset, we were interested in figuring out two things, or trying to be as clear as possible about two things. One is the responsibility for disinfecting, whether that would fall to the user of the room or to the cleaning team, whether it be the AHEC cleaning team for AHEC buildings or the CU Denver vendor for CU Denver buildings. And secondly, who would be responsible for providing the materials for disinfecting? And by and large, the responsibility in terms of the spaces, the crews, whether they be AHEC or CU Denver, are going to be disinfecting the doors, the high touch areas, and the common spaces in the buildings. But they're not going to be in charge of disinfecting instructional labs, classrooms, research labs, and departmental spaces. So that's where the responsibility line is drawn. In terms of providing the materials or the cleaning supplies for units to clean instructional labs and research labs and departmental spaces, in conversations with AHEC, we've talked about the AHEC cleaning team providing cleaning supplies for classrooms so that students and faculty can clean the stations before and after classes. In the research labs, we have recently found out that there's some alcohol and other cleaning supplies that we can get to people who are back in their research labs. And then for departmental spaces, I know that our facilities team has been able to procure quite a bit of disinfecting supplies that we're figuring out a process and will soon be communicated to units as to how they can obtain those disinfecting supplies.
All right, team, we have 4 more questions. Can we power through? All right. We have facilities which students typically use on evenings and weekends. Will units be able to do that? So if let's say that you're the College of Architecture and Planning and you need students to be able to come in and use the studio on weekends, how will that be handled?
That's a difficult
That's a difficult one, and I would say that if a unit needs to operate on weekends or during evenings, it should be part of their unit plan, and they will need to make a compelling case for why those need to operate, and also have a safety plan and a cleaning and disinfecting plan in place that convinces the review team, whoever that is, that all the challenges have been addressed.
And I would just add to that, we have a somewhat parallel plan just developed for research and creative activities. Fairly small numbers of people, but people that can only come in on weekends or evenings. So it is possible, it just needs some special attention, I think.
Okay. Will we be able to expand resources such as laptops and Wi-Fi hotspots for our most marginalized student populations to take home? Elena, do you know the answer to that one?
Well, the short answer is it's in progress, and we are certainly looking at all the options that we have available to us to provide as much of this technology to students as we can, and we're pulling some resources together for that. So we're doing our best for sure, and this has been an active topic of discussion, for instance, today. So we will continue to work in the space and hopefully have a plan that we can articulate soon.
How are we looking at air circulation in buildings? How are we assessing the safety of our air circulation?
I will take a stab at this. by starting off and just clarifying I'm not a building engineer. And I think Jay Campbell, our executive director of facilities, would definitely be far more qualified to answer this question. And in the conversations I've had with Jay, I know his team is doing quite a bit to prepare the buildings that are owned by CU Denver in terms of air filtration and air circulation, and more or less optimizing the number of air exchanges we're getting in the buildings and changing out the filters, and doing things that have been recommended by different associations that address building management and building operations. So I know that his team is hard at work doing a number of those recommended items. In fact, when I have just an aside, I have a good friend who works in building commissioning. He put together a checklist for the CDPHE related to their own buildings. And I shared that list with Jay, and he mentioned to me that he and his team have already done most of the items on the list. So I know they're hard at work prepping the buildings for everyone to come back in the fall. And the buildings really haven't been shut down. So I know a lot of the concerns that I've read and heard have to deal with things that can happen when buildings are shut down and then they have to be ramped back up when people return in the fall. That should not be the case for us, but I wish I had more specific information to share. But I think we can talk about maybe a format for sharing exactly what it is that we're doing to prepare the buildings with the broader university community at some point.
All right. If staff, faculty, and students will require a badge, then do visitors? I'm guessing the answer to that is no, because our badge is our CU Denver ID, and we're not asking visitors to have a CU Denver ID. Are we asking for like maybe a temporary badge that says, visitor that's been approved?
So we kind of addressed this, but they will need a sponsoring unit on campus. He sponsors them to come to campus. We're currently evaluating the sign-in procedure, so we know who's been on campus if they're visitors. A badge as such, we haven't really explored that. I mean, maybe some sort of temporary written badge showing that they've been authorized to be on campus, but I would say right now it's just a sponsoring unit and some sort of sign-in procedure.
Okay. All right, we still are getting questions trickling in, so I'm gonna call it. We'll answer these last three, and then I think we all need to be free to go. So will we be sharing cleaning supplies with student users, and how do we sanitize cleaning supplies in between use? Hadn't thought of that.
So I'm not sure what's meant by that. So we are going to have, much like you see in the supermarket, we're going to have stands with pull-out wipes that individuals can grab, say when they're on their way into classrooms, to be able to wipe down their desk and their seat as they enter a classroom. We are going to have spray bottles with disinfectant. I imagine that the spray bottles with disinfectant that are in the units are for the units and will be handled within the units. There is talk right now about possibly issuing students a welcome back to campus kit that includes their own personal spray bottle, potentially a lanyard for their badge, and maybe a CU Denver branded mask, but that's still in discussion right now. I don't think we'll be sharing cleaning supplies with students sort of far and wide, maybe locally with student employees within units.
Okay.
Kelly, I think, sorry to jump in, but
Okay.
the only circumstance I could imagine where that would occur would be in a classroom or an instructional lab where the cleaning vendors would be supplying the bottles, spray bottles, and the wipes and for students and or faculty to use in the classroom, either before and or after the classroom is over. In terms of how, so that's the only example that I can really think of where that might occur.
Okay. Second to last question, will records be created and maintained for temperature readings and health attestations, and how does this intersect with protected medical record and privacy information? Good question. I think a lot of people are wrestling with this right now. I mean, we have an obligation, right, to keep employee information confidential. And so it's not like, so whatever is created will be consistent with our requirements to keep employee records confidential. However, we also have an obligation to do contact tracing if that is in fact required. We will not be disclosing people's identity in terms of contact tracing. So we would not go to someone and say, hey, John Smith was just diagnosed positive and you were with him. So we would say, you know, contact tracers will say, you have been exposed to someone who is positive for COVID-19. So this is something that is, it's a really great question, but it's also something that people are hyper aware of right now, and we'll make sure that we build in all the protections to that system. I know that legal is very much interested in this question and is very, we'll definitely make sure that we all comply with the law.
Yeah, an MOU is being constructed with Denver Public Health regarding contact tracing, and privacy issues will be part of that MOU.
Okay. Last question. Is it recommended that staff complete the Skillsoft training now or closer to the timeline for their unit return? It seems like the training has or will continue to change.
That's a great question. I mean, my personal opinion is there's no time like the present. The Skillsoft training will change, but it's pretty accurate. What's in there right now, there's 1 or 2 extraneous slides. By that I mean they apply more to the Anschutz case about one about working in a more clinical setting, the other about working in a research lab that's more applicable to Anschutz. But other than a couple of slides, you know, I took the training weeks ago and I feel well prepared to come back to campus, where I am right now, by the way.
And I would say train soon and train often.
There you go.
HR, yeah.
Yes.
All right, so I want to thank all of you who hung in with us. We really appreciate your interest in learning about these things. These are a lot of really important issues, and we appreciate that you're all taking these really seriously. I also want to thank our panelists for hanging in there and going above and beyond. This will not be the last time that we're answering questions. We may need to hold another webinar in the future, and we'll definitely be open to doing that. So, so stay tuned. Thanks, everyone. Appreciate it.